Hello.
Hello.
Dr. Puneet, you can start.
Yes. Okay, ma'am. Good evening, all. Today we have logged into this webinar for the presentation of the SLOs and the other modules as per the CBME curriculum for the competencies BI 6.7 to 6.14. I am Dr. Puneet A, Assistant Professor from Fadamula Medical College, Mangalore. I take this opportunity to thank the organizers of this workshop, Dr. Bedi sir, Dr. Nibriti ma'am, Dr. Sucheta ma'am, and others for organizing this workshop and guiding us on improving ourselves for implementing the new curriculum in our institutions. I am also very grateful to our group mentor, Dr. Pragna Rao ma'am, and the senior member in our group, Dr. Punima Manjrekar, for their continuous guidance on the SLOs and the modules. I also like to thank my fellow team members who have actively participated in the writing of the SLOs and taking up the responsibility to work out the respective modules given to them. So the objectives of this presentation is the introduction, the SLOs for the competencies 6.7 to 6.14, the teaching learning methods, allotted hours and the assessment methods, ECE, SDL and integration modules, sample questions for the assessment and summary. So with this small introduction, I now hand over the mic to Dr. Sudha for her presentation on the SLOs. Dr. Sudha ma'am, over to you. Sir.
Yes. Please unmute Dr. Sudha.
Yes. Please give me a list on WhatsApp.
Yes, sir, I will WhatsApp you the list.
Sending Dr. Sudha and Dr. Pankaj.
Thank you, Dr. Puneet. Good evening, everyone. This is Dr. Sudha, Associate Professor, Vinayaka Missions, Kripananda Warrior Medical College, Tamil Nadu. For our group CBME 6, we will be presenting the competencies from 6.7 to 6.14. First, we'll be seeing the competencies 6.7 and 6.8. We have combined the competencies which can be dealt together. 6.7 is describe the processes involved in maintenance of normal pH, water, and electrolyte balance of body fluids and the derangements associated with these. 6.8 is discuss and interpret results of arterial blood gas analysis in various disorders. Next slide, please, sir. For the topic acid-base balance and pH, at the end of the session, the first MBBS student should be able to define the terms acid, base, strong acid and base, weak acid and base. Define the terms pH, pKa and buffer. Describe Henderson-Hasselbalch equation and its application. Describe mechanism of action of buffer. Enlist various acids and bases produced in the body. Next slide, please. Next slide, please, sir. Describe mechanism of regulation of blood pH by blood buffer systems with respect to composition, ratio, reaction to acid or base addition, advantages and disadvantages. Number 7, explain the biochemical changes in the bicarbonate buffer system in acidosis and alkalosis with the help of Henderson-Hasselbalch equation. Describe the role of respiratory system in regulation of blood pH with respect to role of respiratory center, isohydric transport of carbon dioxide and chloride shift. Next slide, sir. Next one is the describe the renal mechanism in regulation of blood pH with respect to hydrogen ion excretion, ammonium ion excretion, phosphate buffer, bicarbonate ratio, reaction to acid or base reabsorption. Distinguish the acid-base disorders as acidosis and alkalosis with a note on normal reference ranges of pH, PCO2, PO2 and bicarbonate. Describe anion gap, differentiate between high anion gap and normal anion gap metabolic acidosis and their clinical importance. Next slide, sir. Discuss the causes and clinical features of respiratory acidosis and alkalosis and metabolic acidosis and alkalosis and the compensatory mechanism. So this is a topic which can be done as nesting with medicine department. List the important components pH, PO2, PCO2, bicarbonate and oxygen saturation of an ABG report and state their reference range. Enlist other biochemical investigations to be done in the diagnosis of various types of acidosis and alkalosis. Analyze and interpret the ABG report for respiratory and metabolic acidosis and alkalosis and briefly state the corrective measures. Next slide, sir. The next topic would be fluid and electrolyte balance. The SLOs are explain role of various hormones in maintaining water electrolyte homeostasis, which can be shared with physiology department. Describe the distribution of water and electrolytes in different compartments of the body. Explain the concept of osmolarity and osmolality and the factors affecting the osmolality in ECF and ICF. Explain hypernatremia and hyponatremia with respect to causes, biochemical basis of clinical features, complications and management modalities. Next slide, sir. Explain hyperkalemia and hypokalemia with respect to causes, biochemical basis of clinical features, complications and management modalities. Explain hyperchloremia and hypochloremia with respect to causes, biochemical basis of clinical features, complications and management modalities. All the above 4 topics can be done as nesting with medicine department. Describe dehydration with respect to the causes, biochemical basis of clinical features, complications and management modalities. Describe water intoxication with respect to causes, biochemical basis of clinical features, complications and management modalities. Next slide, sir. Next, we have combined competencies 6.9 and 6.10. The competencies are describe the functions of various minerals in the body, their metabolism and homeostasis. 6.10 is enumerate and describe the disorders associated with mineral metabolism. Next slide, sir. For the topic minerals, at the end of the session, the first MBBS student should be able to differentiate between principal elements and trace elements with examples. State the distribution, dietary source and requirement of principal and trace elements in the body. Discuss the absorption of minerals in the body with special reference to calcium and iron. Describe the biochemical functions of calcium and phosphorus. Explain the homeostasis of blood calcium level. Next slide, sir. Enumerate the causes and clinical findings of hypocalcemia and hypercalcemia. Mention the disorders of bone mineralization and list the biochemical markers of bone diseases. List the causes and features of hyperphosphatemia and hypophosphatemia. List the causes and features of hypermagnesemia and hypomagnesemia. Discuss the biochemical functions of sulfur. Next slide, sir. Describe the biochemical function, cellular regulation of absorption, transport and storage of iron in the body. Discuss the causes and features of iron deficiency anemia. List the features of iron toxicity. List the tests used in laboratory evaluation of iron status and the treatment of iron deficiency. Explain the biochemical functions of trace elements like copper, iodine, fluorine, selenium, zinc, manganese, molybdenum, cobalt, nickel and chromium in the body. Next slide, sir. Explain the potential impact of zinc supplementation in conditions like diarrhea, etc. and with a special reference to COVID-19. Describe the manifestations of zinc deficiency. Discuss the causes and features of abnormality in copper metabolism. Enumerate the features of selenium deficiency and toxicity. Describe the causes and features of fluorosis. Next slide, sir. Next is competency 6.11. Describe the functions of heme in the body and describe the processes involved in its metabolism and describe porphyrin metabolism. Next slide, sir. Next slide, sir. For heme metabolism, at the end of the session, the first MBBS student should be able to enumerate important heme-containing proteins, describe the steps of heme biosynthesis with special emphasis on coenzymes and their regulation, define porphyria and discuss acute intermittent porphyria in terms of clinical manifestations and laboratory findings, explain breakdown of heme and transport, conjugation and excretion of bilirubin in the body. This can be done as sharing with physiology department. State the reference range of total, conjugated and unconjugated bilirubin. Define and classify hyperbilirubinemia with their clinical significance. Classify the types of jaundice and enumerate their differential diagnosis. So these SLOs will be again reinforced under the LFT competency 6.14. Now I hand over the session to Dr. Puneet for reading the remaining SLOs.
Thank you, ma'am, for your presentation. Good evening again. Myself, Dr. Puneet A, Assistant Professor from Fadamulla Medical College, Mangalore. I will be taking you through the competencies 6.12 to 6.14. So the competency 6.12 describe the major types of hemoglobin and its derivatives found in the body and their physiological or pathological relevance. So the topic hemoglobin metabolism. At the end of the session, the first MBBS student should be able to 1. Describe the structural and functional characteristics of the normal and abnormal hemoglobins. 2. Enumerate the functions of hemoglobin. 3. Explain the functions of hemoglobin, in particular the oxy and deoxyhemoglobin. 4. Explain the chloride shift and Bohr's effect. 5th, describe the effect of pH, CO2 level, 2,3-bisphosphoglycerate, sickle cell hemoglobin and fetal hemoglobin on hemoglobin oxygen dissociation curve. 6th, explain the molecular basis, diagnosis and management of hemoglobinopathies, especially the sickle cell disease and thalassemia. 7th, enumerate different types of hemoglobin derivatives and describe the characteristic features of carboxyhemoglobin, carbaminohemoglobin, methemoglobin, and sulfhemoglobin. Coming to the next competency, BI 6.13 and 6.14. These two are combined again. So 6.13 describe the functions of the kidney, liver, thyroid, and adrenal glands. 6.14 states describe the tests that are commonly done in clinical practice to assess the functions of these organs, that is the kidney, liver, thyroid, and adrenal glands. Coming to the SLOs, for the renal function test, at the end of the session, the first MBBS student should be able to 1. Describe the glomerular, tubular, and extrarenal functions of the kidney. 2nd, classify and enumerate renal function tests and discuss the tests with normal values. Question number SLO 3. Describe the renal function test based on glomerular, tubular function and urine analysis. 4th, analyze and interpret the renal function test with respect to diseases like renal failure, proteinuria, nephrotic syndrome, glomerulonephritis, etc. The next topic, liver function test. At the end of the session, the first MBBS student should be able to 1. Describe the synthetic, metabolic, detoxification, and excretory functions of the liver. 2nd, classify the liver function test based on the functions of liver and discuss the test with normal values. 3rd, differentiate the different types of jaundice based on biochemical tests. 4th, analyze and interpret liver function test with respect to prehepatic, hepatic, and post-hepatic jaundice. The next topic is thyroid function test. So at the end of the session, the first MBBS student should be able to 1. Describe the functions of thyroid gland. 2. Discuss the thyroid function test with normal values, that is the TSH, T3, T4, FT3, FT4. 3rd, analyze and interpret the thyroid function test with respect to hypothyroidism and hyperthyroidism. The next topic is adrenal function test. So at the end of the session, the first MBBS student should be able to describe the functions of adrenal gland. 2. Describe the adrenal function test in terms of adrenal cortical hormones with clinical significance. That those are the ACTH, cortisol, the suppression and stimulation test of these hormones. With this, we end the SLOs. this is the table that we have for the suggested pedagogies for the competencies. I now hand over the mic to Dr. Pankaj Kambale for the presentation of TCE. Over to you, sir.
Thank you, Dr. Punit. I am Dr. Pankaj Kambale, Assistant Professor in Grand Government Medical College and Sir JJ Group of Hospital, Mumbai. I will be presenting early clinical exposure. It is based on nephrotic syndrome. Next slide, please. Setting will be classroom setting. It is a case-based scenario, and competency which will be covered is BI 6.14. Next slide, please. Objective at the end of this ECE session, phase 1 students shall be able to define nephrotic syndrome, enumerate clinical features and cause of nephrotic syndrome, explain biochemical basis of clinical features of nephrotic syndrome, enumerate biochemical laboratory tests that are done in nephrotic syndrome, interpret the biochemical laboratory reports in nephrotic syndrome, explain in brief the line of management. Learning experiences, total allotted time 3 hours. First 20 minutes will be allotted for introduction to the topic, group division, group discussion within the peers. Exposure to clinical case scenario and discussion will be having 90 minutes. Next 10 minutes will be having summary and conclusion. Assignment allotted time is 30 minutes, and for reflection another 30 minutes. The case: a 2 years old male toddler comes with the complaints of fever, cough, and swelling over face. He also had decreased urine output. On examination, he was febrile and edema was present over face and lower limbs. Laboratory findings are as follows: urine protein +3, serum albumin 2 gram per deciliter, serum cholesterol 340 milligram per deciliter, and serum electrophoresis showed increase alpha 2 band. Discussion on question: what is the probable diagnosis, what are the causes of disease, what are the other associated clinical features of the disease, what is the biochemical basis of clinical features, explain the biochemical basis of laboratory findings, what is the basis of bedside monitoring of urinary proteins by dipstick method, and briefly outline the treatment of the disease. Now I hand over the presentation to Dr. Punit.
Can you please unmute Dr. Puneet Saxena, sir? Puneet Saxena. Hello, Dr. Bedi. Dr. Puneet Saxena is having some problem unmuting. Can you please check at your end?
Ma'am, Dr. Puneet Saxena is to be unmuted?
Yes,
Yes,
Dr.
ma'am.
Puneet Saxena.
Okay. I'll do that. Yes, unmute.
Okay,
Please
thank you
check
very
it,
much,
Dr.
Dr. Pankaj.
Yes, done.
Oh, I'm Dr. Puneet Saxena, Associate Professor of Biochemistry, Government Medical College, Surat. We are presenting CBN exercise, and we're discussing case of diabetic ketoacidosis. The competency which is being addressed is competency 6.8. This is a teaching learning method, is a small group discussion, and duration is of 1 hour. The case is a 15-year-old boy presents with a complaint of high-grade fever for last 2 days. He's having fruity odor in his breath. The history of excessive hunger, that is polyphagia, polydipsia, and frequency of urination. The clinical examination revealed severe dehydration. Respiratory rate is 30 per minute, that is tachypnea. His laboratory findings results are as follows. Can I have next slide, please? So these are the reports, clinical chemistry reports, the abnormal reports which I have already highlighted, like serum urea 52, plasma glucose level 360 milligram per deciliter, blood ketones 8.2, and ketone bodies are present in the urine, and glucose is present in the urine. The ABG report says 7.2. So all these are abnormal results we have highlighted for the students. Next slide, please. The discussion on questions will be: what is the primary acid-base abnormality? Draw a concept map linking biochemical abnormalities with symptoms of diabetic ketoacidosis. Next is there a compensatory mechanism of metabolic alkalosis in this patient? Third question is calculate the anion gap. What are the other causes of metabolic acidosis? Next slide, please. Next is self-directed learning, which is prepared by Dr. Priya K. Das and Dr. Purnima Mandrekar ma'am. And both of them are not able to present, so I'm presenting on their behalf. The objectives are to achieve a deep approach towards the subject, understanding ideas by themselves, applying knowledge to new situations, using novel experience to explain the concept. Topics in the competencies we are addressing is all like 6.7 to 6.14. For example, derivatives of hemoglobin and traces element. The duration is 1 to 1.5 hours. Next slide, please. The topic trace elements. The specific learning objectives are: at the end of session, the phase 1 MBBS student shall be able to discuss the biochemical functions of trace elements. Next is mention the dietary requirements, sources and absorption of trace elements. Explain the causes and disease states or abnormalities associated with the metabolism of trace elements. Next slide, please. So this is the plan of SDL. 1 week before the SDL, the students will be divided into 4 teams. Say for 100 students, they will be divided into 4 teams, and the resource material will be given 1 week prior to them. And each team will be given a specific task like preparing e-posters, MCQs, reasoning, or OSPs. And the students are informed that they will be assessed at the end of the session. Next slide, please. This is a case vignette. An 11-year-old boy was presented to the pediatric OPD with major complaints of yellowish discoloration, piles, fever, anemia, swelling of feet, and abdominal distension. Lab finding revealed decreased ceruloplasmin and copper in plasma with increased urinary copper. Kaiser Fisher on the both eyes with decompensated cirrhosis was confirmed. The questions which are to be discussed are: what is the probable diagnosis? Explain the biochemical defect. What is the cause for KF ring on the both eyes and cirrhosis? Explain the causes for anemia observed in this child. Next slide, please. Can also give them to making the e-posters on auspice, like these are the diseases, pictures with the disease and the name of the elements on there. So identify the clinical conditions, which mineral deficiency leads to these conditions, what are the clinical features of these conditions, write the RDA and sources of the mineral. Next slide, please. As far as the assessment is concerned, each group can present their given task within time frame, say for 15 minutes. They may be having a quiz program and 3 members from each team as we have planned. And the best team will be awarded. Next slide, please. Next is integration, which is prepared by Dr. Priya Bhatkulkar and Dr. Arsuda. So over to Dr. Arsuda. Thank you very much.
Thank you, sir. Thank you, sir. So this is Dr. Sudha again presenting the integration module. The topic we have chosen for integration is jaundice. This can be done as sharing the objectives with physiology department and nesting with the objectives from pathology and general medicine. The time which can be utilized for integration is 1.5 to 2 hours. Next slide, sir. Next slide, sir. So if you see the competencies related to jaundice comes under BI 6.11, 6.13 and 6.14. As we see in this slide, we have similar competencies in physiology, pathology and medicine department. So this is a potential topic for integration, and a case study of jaundice can be used as a linker between this department, and integration can be conducted so that repetition can be avoided. Next slide, sir. Next slide, sir. Specific learning objectives we can use for this integration module, and this is a case study example of obstructive jaundice which can be given to the students and used as a linker for integration. Next slide, sir. So the integration can be planned as follows. So the students can be given a pre-test questionnaire containing few questions based on different types of jaundice, which can be done for around 10 minutes. Then set induction and case history, which can be done by medicine department for around 10 minutes. Then metabolism of bilirubin can be dealt by physiology department for around 20 minutes, and hyperbilirubinemias can be dealt by pathology department, which can be done for around 20 minutes. Then laboratory investigations of jaundice can be done by our biochemistry department, which would be for around 20 minutes. Then summarizing the whole topic for around 10 minutes. Then after all these, the students can be given a post-test questionnaire showing different case reports of different types of jaundice, which can be done for around 10 minutes. So the whole time required for this integration module will be for around 1.5 to maximum 2 hours. So that is about the integration. Now I hand over the session to Dr. Puneet.
Thank you, ma'am. I'll be just presenting some of the sample questions we have prepared. This was prepared as per the requirements of our two universities, that is the Rajiv Gandhi University of Health Sciences and the Manipal Academy of Higher Education. For the long answer questions, we have used the topic iron metabolism. And for the structured essay question, we have used the topic calcium metabolism. For the short answer questions, we have used the topics clearance test, sickle cell anemia, and porphyria. And for the MCQs, we have used the topic thyroid, hyperkalemia, and copper. Now I will be handing over the presentation to Dr. Pragna Rao ma'am for the summary. Over to you, ma'am.
Thank you. Thank you very much. Good evening, everyone. So this was Group 6. Let me tell you first that these competencies were challenging because of the vastness which is involved and that it is completely clinical in nature. When for first year things are completely clinical, always the difficult thing is how much can we get into the clinical details for first year students. So we have to tread a very fine balance, and I think this group has done a wonderful job of finding that balance, making it clinically oriented and yet sticking to basic biochemistry. I think really this group requires a round of applause for it. I also learned something more when I interacted with this group, and that is a lot of our biochemists are now involved with COVID duty. Yes, they're also now learning the ropes of CBME since the past 1 year. And having done that, they are actually venturing, some of them for the first time, into positions of leadership, into positions of representing their college in these webinars, representing their departments, representing themselves, because some of them may be speaking in public for the first time. So these skills are also being learned along with writing SLOs and writing, making the cases, etc. So I think overall it has been a great learning experience for all of us. I would particularly like to thank Dr. Purnima Manjrekar, who was my deputy in terms of leading the group. She did a fantastic job. Dr. Puneet Saxena, Dr. Sudha, Dr. Pankaj, and Dr. Puneet A, who was our tech man and go-to man throughout this whole exercise. Of course, Dr. Priyanka and the two Dr. Priyankas and Dr. Priya also helped us to make presentations, but unfortunately they were not here in the last minute for the actual verbal presentation. So these were my takeaways from Group 6, and I hope that it has helped everyone to look at the SLOs, and they will be available on the Google Classroom for more comments. Dr. Sucheta, we are now open for questions. Any questions? We are waiting for any questions or any inputs from faculty or other attendees. Hello? Hello?
I am not unmuted, madam. I will ask.
Okay. Can Dr. Sucheta please be unmuted?
Can Sucheta madam be unmuted?
Okay, can you start with the questions? Then Dr. Sucheta will join until she's unmuted.
Dr. Bedi sir?
Should I unmute madam?
Bedi sir, can you unmute Dr. Sucheta?
Okay.
Yeah, thank you, Dr. Bedi. So, there aren't any questions. So, do we say that you can put this up on the on
Dr.
our
Vasikala?
yeah.
Dr. Vasikala, please unmute yourself.
Yes, sir. Yeah. Good evening,
Dr.
everyone.
Sanjay Bedi, Dr. Nibriti Das also wants.
Shall I go, Dr. Bedi, sir?
Yes,
Yes.
Yeah. So good evening, everybody. I'm Dr. Sunanda, Professor HOD of Biochemistry in Mamata Academy of Medical Sciences, Hyderabad. It's a great learning experience to me in attending these webinar sessions. Yeah, one of my doubt to Dr. Sudha ma'am is that the initial competencies 6.7 and 6.8 is the time given to complete those particular SLVs will not be short enough, because so much to say about Bohr effect and all, and then that oxygen carriage, so many things are there, around 14 to 16 SLOs in that. So, and the time given is, I felt it was very small time given over there. So, can we cope up? Can Sudha ma'am or Pragna ma'am can answer to this?
To unmute me, that's all.
Yeah, I'll just ask Dr. Sudha to take your question.
Yeah.
Dr. Puneet.
Can
Okay,
we go
ma'am,
back
because
to
this
the
is a
first?
No. Huh? Yeah, sorry. Yeah.
Yeah.
Ma'am, even before this, ma'am, I think it is 6.7 and 6.8. Yes, ma'am. Yes.
This one.
Yes. Yeah. So here the competency, I mean, the SLOs are so many. Is the 2 hours time will be sufficient, ma'am?
Ma'am, and this is a topic which can be done as sharing, ma'am, with the physiology department also. So the repetition can be cut short if we share the topics. If we take it as an alignment or sharing with the department, the time can be little bit reduced, ma'am.
So can you
Yes,
go
also
back to the previous slide, sir? One slide before to this. Yeah, ma'am, here can you see that SLO number 9 and 9, 10 and even 11? To explain them, won't it be taking so little more time? What I feel is that because I mean this SLO 9 describe the renal mechanism in regulation of blood pH. So there will be 4 or 5 steps in that where student need to understand it. What I feel personally, because I am teaching this acid base balance last 10 years.
Okay,
So,
okay, ma'am.
So
yeah, I think we should acknowledge Madam's experience in
going
this.
to be there
And
with the MBBS student, even in his clinical practice also, right? So, shall we extend little more time at
you
this
can
particular?
extend. You
So
can
how many
extend.
hours have you actually put? Let me see it again, if I may.
Yeah.
Yeah.
Ma'am, it's given only 2 hours, ma'am.
So, but here, even this describe Henderson-Hasselbalch equation, there
Oh,
is no
this
need for them
ma'am.
to sort of derive it.
Huh?
No, not derive. Just
No, we won't
explain
derive.
in terms of bicarbonate buffer. That is all that is given easily.
Yes.
Not derivation and all. But I see your point on 2 hours being less. I think
Yeah.
where Dr. Sudha is coming from is that if you're looking at it from a didactic point of view, okay, even if you extend to 4 hours, that's fine. But what has happened is now only 30% is didactic.
Yes,
so when
ma'am.
you say 70% is non-didactic, a lot of these hours will go into non-didactic teaching. So yes, if you
Yes.
see total hours, we can increase, you are right.
Yeah.
But also remember that they may not all be didactic. Some of them might, like for example, define terms, acid, base and all. We don't need to again take a lecture,
Yes.
and they've been doing it, from preschool,
Yes, ma'am.
school and college and all that. So
Yes.
there are, parts where we can, but you're right in that we can extend the time.
Yeah, especially that 6 to 10, the
Renal.
SLO 6 to 10, ma'am. it's
So
actually
6 to
8,
10
9,
you
and
can
10.
do in maybe 2 lectures, and this you
Yeah.
need only 1 lecture actually if you
That's what, man. That's what I wanted, because
So
I thought the time
3 to
given was
4
too less.
lectures is fine, is good enough. 3
Yeah.
lectures is more than enough.
3 lectures is a good enough time. 3 to
Because
4
one
max.
ECE you will do, right? Related.
Yeah.
One ECE do,
Yeah.
ma'am.
So
One
ECE
ECE.
will once more in a small group teaching, the ECE will once more reiterate what you've been saying earlier, and you'll
Correct.
go into depth.
Yes, ma'am. Yes. Yes, ma'am.
And
Thank you,
there
ma'am.
you're
Thank you.
spending 3 hours, you're spending, remember, 3 hours in ECE. So actually it will become 3
Yeah.
plus 3, it will go to 6 hours actually.
Correct.
Yeah.
So
But
here I would like to once more tell you a little bit about this ECE. In the sense, though we may talk about, say, your ECE may be metabolic acidosis, but you can go a step further and discuss everything else related also. Not just do the
yeah.
case and that's the end. Then 3 hours is too much. But in and around a particular case, whatever is related, you can talk to the students at that time. In fact, I
Yes.
also use that, even if though I say take a case, an ECE of say lactic as lactose
Acidosis.
intolerance,
Lactose intolerance. Yes,
lactose
ma'am.
intolerance. And depending on when it is taught, even this,
Yeah.
acidosis, lactic acidosis will be mentioned.
Yes,
Maybe we
ma'am.
can
Yes.
tell them, you will see here, you will learn it later on in acid-base balance, or
Yeah.
small things you can keep on doing so that you make them think a
Correct.
little more widely.
Okay, ma'am. Okay, fine. No, when I was going through, started from the
Yeah,
beginning, I
no,
got
point
a
well
doubt,
taken.
because
Point well
just 2
taken.
hours
Thank
can we
you
do
for
it?
bringing that up.
Okay, ma'am. Thanks a lot, ma'am.
And anyone else wants to ask anything or say anything?
Madam, I would want to make a suggestion that some part of this is covered up in physiology also.
Physiology.
So
Yes.
the repetition part of it, we don't need to repeat it. There will be a correlation type. The number of hours can be reduced.
Yes. And that is the reason why we need to, sit with the physiology people and just ask them, "Aap log kya karoge?"
Exactly.
Correct.
That is
Yeah,
been done.
and then that is where, and now with this integration timetable, both these things are going hand in hand. And with anatomy also, kidney and all they're doing.
Yeah.
Our timetable is made in such a way that physiology will do also acid base, we will do acid base, and anatomy will do kidney.
Kidney. Yes, ma'am. Yes.
So that is where that horizontal integration will come into picture, and our chats with them, with all the 3 departments.
Should
Yes,
go
ma'am.
and them and decide which silos you are going to handle, which we are going to handle. Then it becomes okay.
Yes, ma'am. Okay, ma'am. Fine.
Dr. Nibriti ma'am is going to give her
Yeah, in
inputs.
between I have spoken. I also felt time is too short. But if it is distributed properly by horizontal integration, perhaps it is okay. Because in the clinical side also they say this acid-base balance. They say they never understood anything out of that. They just follow the standard guidelines. The residents say, consultants of course get much knowledgeable. That but they do not know why they are doing what. Most of the time they never understood the concepts behind this acid base homeostasis. So I also felt that a little more time is needed for the students to assimilate the things, but it is okay if it is 3 hours, and if in EC and all the care is taken, and also if horizontal integration is planned very meticulously, so then perhaps it is okay. Otherwise, it looks a little too much within the given time.
Yes, ma'am. Point taken. Suchita, no more questions?
Yeah, no, I think no. One more thing. I mean, I'm sorry, I'm saying this to people who are already present here, but all this we are doing because of our interest in biochemistry, and because we really want to do this out of the love for what all we've been doing. But I find that some people have registered, and they just don't want to be a part of it, or they're just shirking. So this is as good as the trouble that we have with our students, where we are keeping on chasing students, and sort of holding them literally, short of holding them by the collar physically. We are doing all sorts of things to make them respond. So this should not be the case. We are all mature adults, and you all have sort of जानबूझ के तो आप लोगों ने इस पे register किया, तो मजे लो ना, and enjoy yourself doing this, instead of being trying to be shunted into working. So all of us, the faculty, have a very bad taste in the mouth, in the sense we feel sad and we feel sorry that why is everyone doing this. So this is of course not meant for people who are here, but I would like you to somehow, if they are your friends or anyone, at least allow them to tell them that this is the situation and this is not in good taste.
Yeah, Sujata is yes.
It is our traits
Kind of inhibition
into the students. So we should
Yes, madam. Even I feel that people are not contributing.
students for SPL if they don't want to go for SPL.
कितना पीछे लगे ना.
And we can't do it. I mean, we are just mentoring. That doesn't mean that
लगना भी नहीं चाहिए. क्यों लगना पड़ेगा?
it's very difficult to manage.
Yeah, like Dr. Rohini is just saying that she has only 2 people who are active in her group. अभी ऐसे कैसे चलेगा? Dr. Bedi, do you have a solution to this?
I can only I empower the group leaders to certify those who have contributed, and only they will be given the certificates.
That is a good way. That is a good way.
Yes. Alternatively, we can also give the best contributors some extra certificate or some extra incentive in some other way.
So I think Dr. Bedi, if you could just send a mail to everyone and say this, that people who have not contributed will not get the certificate.
Exactly.
Simply, I mean, those who are the group leaders, they have to certify that they have actually contributed. But I can't follow everyone. So those who are the group leaders, they have to certify.
And it is as simple as that. If people don't sit for the test, they fail. Finish. But how they be certified?
Yes, it is just like we are certifying our CBME students. So if they have attained the competencies of making SLOs good enough, they are certified by the group leaders.
Yeah.
And we will think over that those who have actually contributed, we will find something positive for them. That's it.
I think we are done, Sucheta.
Yeah. I think we're done. I don't know. That last part that Dr. Bedi spoke, I had some issues with my net, so I could not hear what he said.
Okay, basically, I think what he said was everybody who contributed should be well acknowledged.
No, I think again my this quality is giving me a problem.
So I think we are not getting any more questions. So Dr. Bedi, can we call it a night?
Ma'am, Dr. Neela wants to be unmuted.
Who?
Dr. Neela.
Dr. Neela. I think Dr. Bedi will have to do that.
She has messaged in the group, ma'am.
Dr.
Okay.
Neela is
Dr.
unmuted,
Neela.
please.
Yes, she's unmuted. You have self-muted, Dr. Neela.
Yeah.
Please.
But I can't. Hello.
Yes, yes,
Hello.
yes, Dr. Neela.
Huh. I was trying. I was trying very hard to contact you. So I was listening what you were talking and all that. But I could. Nobody unmuted me. I think this topic is very important. Clinical point of view, acid-base balance and water electrolyte throughout their lifetime. So I think more time should be given to the students to understand this, because this concept of
Yeah.
acid-base balance and that I want to actually
So we
share.
agreed that we will increase it to 3 hours and 3 hours
Yeah.
of ECE. So it will be a
Yeah.
total of 5 hours.
Because water
ECE is
electrolyte.
compulsory on acid-base balance. You must have one ECE every year, one of the
Yes.
4 parts. Huh?
Yeah.
So that
Yeah.
will be 3
And
hours.
And madam, for SDL, we were talking about. So for the SDL, I think acid-base balance is a right topic for SDL. Is it? Or we can just give them the abnormalities or the disorders related to that after taking a lecture,
That also
and
can
then
be
they
done.
will come.
That also can be done. So you have
Yeah.
one ECE, one SDL, and one. So, but then for SDL, you will have to be very specific.
Hello.
You know, they
Yes.
will just keep on and on. You can just give them a small thing like chloride shift and some small aspects,
Yeah.
you know,
Yeah.
or
So
just
small topic. Yeah.
hemoglobin or just
Yes. And
RBCs, you know, some one aspect. Okay, just ask them to read that much.
yeah, so at least they will read it and they will come out with their difficulties and all. Otherwise they will just mug up the things whatever is taught to you. So at this level, phase 1, at least some exercise related with the SDL should be there, and this is being a very important topic. I think they should read by themselves also, so it will be helpful for them from where to get the material and all that. Hello.
Yeah, thank you. Thank you, Dr. Neela.
Oh, thank you, madam.
Yes, Dr. Anita Bijur has raised her hand.
Yeah, good evening, everyone. Just a thought. Madam, I know we are well into group 6 presentations that's just completed. I was having a little issues in the sense that, the presentations when, it's when you read the PPTs and it goes, one after the other. For those who haven't kind of really taught those chapters for a little, quite some time, it becomes difficult for us to follow whether to see, whether the SLOs are, really apt or not. Because I think we need to sit with, the syllabus and probably with the SLOs that we had prepared for the previous batch, and then, compare and look and see whether how best we could improve with, the inputs from all these various groups. So I was just thinking, would it make a little more, maybe a better difference if these PPTs could be put up maybe a day or two before the presentations, so that the rest of us get some time to go and have a look at it. Now, what happens is, madam, these are put up, much later. And then to put in our comments and to change it becomes a little, I think, this is my personal thought view, that would it be a little better if we could have the presentations a day or two, because see, I cannot now move the presentation, no PPTs, I cannot move the slides. If I want to go back and look at something, I cannot do it. So would it be a little better or something if the presentations could be, put up on the group maybe a day or two before the group presents it, so all of us are ready with our inputs?
Dr. Sucheta, you want to take that? Because I want to come in here. Point noted, Dr. Anita. But I have another way of looking at it. See,
Yes,
a lot of these teachers are very busy, and if things are coming in towards the last minute, there's no denying it. However, there's another
Can I
way
say
that,
something here? I the trouble is I'm having something wrong with my audio. I
audio.
think
Okay.
but
Net is low.
yeah, but anyway, yeah, my net there because I've been using it a lot for the CISP workshops and all. So maybe it's giving me problem now. But anyway, what I wanted to say is, Dr. Bijur, as it is, everyone is working last minute. So it will be very difficult for the deadline for, we sort of finish everything. Let's be frank, just the previous night. But you can very well do the same thing that you were talking about of comparison after they are put up, na?
Yeah, see, the other thing is,
And make the comments.
yeah, the other thing, Dr. Anita, is that we
yes,
are finding that there's a lot of variation from college to college in terms of the minor stuff. The major things are still there, but the minor
okay.
stuff and the decisions on whether to keep this as didactic, non-didactic, STL, PBL, CBL, all that varies from college to college. So in those terms, we cannot give a watertight SLO, nor can we give a watertight kind of topic for all the non-didactic part. So we give an example, but then it's there on the Google Classroom for everyone to see, and it's up
Yeah.
to every college to use that only as a scaffolding on which they can modify whatever is there. I mean, we don't want to, keep this as written in stone that other than this,
No,
nothing will
true.
be done.
True, ma'am, true. But I was just thinking because, like constructively, we are not able to, then and there give any kind of,
Yeah,
input, ma'am. So, like I want to go back to, okay, what you said about 6.2, but then I have no way to go back.
Okay.
So it's
Maybe
that's
the
where I
comments
felt
can
this
be
disconnect.
put up on the Google Classroom.
Okay, we can do that, ma'am. We'll do that.
Yeah. We can
We'll
discuss
do that.
that.
Yeah. Thank you so much, ma'am. Thank you.
Thank you, Dr. Anita.
There are some more speakers. Dr. Jaya, Dr. Suganti.
Thank you, sir. This is Dr. Jaya. Am I audible?
Audible.
Yes.
Yes. First of all, I think it was a very nice and lucid presentation by this entire group. Very well outlined. Just a couple of points actually I wanted to make. Number one is about the doctor who raised regarding lot of SLOs and the number of hours are less. So if you see some of the SLOs is something that we can define as a prerequisite, for the students to come to the class. So like what are assets, what are bases, this is something that they have learned. So maybe these can be defined and told to the students that this is a prerequisite for you all to come for the class itself, though it is an SLO. So we don't go all over again. That was one suggestion that we could probably, kind of define in our SLOs within the, the department. The second thing I want was that I think it was very nicely, I wanted to just thank that the fact that we could have multiple cases being discussed during an ECA, because so far we've all been presenting a single case as part of an ECE. But ECE, definitely sometimes we cannot restrict ourselves to one case. Even when we send students out to the wards, they're not seeing the same case on the same day. Even if it is anemia, it's different varieties of anemia or types of anemia they're seeing. So the same thing we can incorporate and have multiple cases given to each group or in the class of 3 hours, because one case would be very long. And the third thing is whether, if time permits, I'm not sure we're discussing all the theoretical aspects SLOs, whether we are also going to discuss the SLOs of the practical portions. Because like, for example, in acid base, we have a lot of link to the practical portions like a pH meter, an ABG, even interpretation of reports. So whether that is also going to happen was something we wanted to know. Whether we will be discussing even the practical SLOs, or we are only restricting to the competencies in the theory.
I think
Ma'am,
one
I'm done.
group is taking the practical SLOs. The last group
Okay.
will be taking the practical SLOs.
Okay. Okay.
I think we can incorporate the practical part also. If it's an ECE, it doesn't need to be only restricted to the theoretical part of practical part
Yeah,
can
that's correct,
then
Rohini. That's
becomes
really
a
good.
wholesome thing. It becomes a complete thing. So that is
Yes.
how we have to have an ECE. It's just
Yes.
not compartmentalizing it.
Yes.
That's the way we should plan our ECE.
Thank you, ma'am.
Thank you.
Dr. Suganti?
Good evening, all of you. Am I audible? Audible, madam?
Yes, Dr. Suganti, you're audible.
Actually, what Dr. Jaya spoke is the same thing I was just going to. Madam, usually we have charts prepared on this liver function test and the ABG, arterial blood gas analysis. It will be the case history and all these things. And our university, we have marks for that, 12 marks like that. In that, it's compulsory that they have to get one LFT and ABG chart apart from others. The problem is when we take up the teaching, what happens, they do very well, small group discussion, everything. But when we sit for as a teacher to conduct the viva in the particular chart, the experience is like very limited. For if you can, I mean, all senior people are there, if they can share.
Hello. Hello, Dr. Suganti, can you hear me?
Yes, madam, we can hear you.
I don't think Dr. Suganti can hear.
Hello.
I think Dr. Suganti has some tech issues. Dr. Rohini, can you see if Dr. Suganti?
I'll just put it, yeah, on the group.
Dr. Sugandhi is self-muted. Please unmute, ma'am.
Thank you, madam. I just wanted to know, madam, we have a chart discussion conducted
I
as
got the
a part
question,
of
Dr.
EC.
Suganti.
Yes, madam.
Yeah,
How
we
to
got it.
cope up
Got
with
the
the Viva
question.
was uniformly?
Yeah, it's
Just
very simple. It's very simple. See, the thing is, we don't have one chart. You have many charts.
yes,
Many
madam.
charts regarding acid base, and students don't know which one will come. That's the way it works. Because if you have a single chart on LFT, a single chart, in fact, we have so many charts in terms of LFT or in terms of acid base balance. For example, I'll just give you Hayes test, isn't it? All
Yes,
students
madam.
do Hayes test. So you could have 2 or 3 samples with different Hayes tests performed, one positive, one negative, or something like that, and ask
Yes,
the student and keep the Fauchet's test result also along with the Hayes test, and ask the student to interpret. Okay, so what
yes,
is this for it for patient A, patient B, patient C, and you can change the combination. So what happens is the student is never sure what he is going to get.
mm.
That is how they
Yes.
improve on it. Otherwise, they know exactly which chart is coming and they will mug it. But you should keep varying the different charts.
Mm. That's actually what we tried, madam. We kept that case and we were try to change the values. That's what
No,
we
no,
did.
that
But still,
doesn't work. That doesn't work.
but
That
it was not
you
working.
have
I
to
just
change
wanted
the
to know from
entire
other
chart.
people what they do. That's
Yeah.
what. Madam, one more thing, what happened this time because of COVID, we didn't complete our acid base disorder. So one thing what we did in online, we have and that ABG calculator. It is
Right.
free online. When that was posted for the students, they felt very happy to do it because it comes with the
Great idea.
thing.
Yeah.
So that can be incorporated for the
Yes.
SDL also.
No.
A
Yes.
suggestion.
Why not? Why not? Great idea.
That's very nice.
Thank you for sharing it.
Uh,
Yeah. Thank you for sharing it.
Yes, I
Great idea.
wanted to share that also, ma'am.
Great.
Thank you.
Thank you.
Thank you very much.
Dr. Bedi, we are done, I think.
Okay, ma'am.
Yeah. So thank you especially to Dr. Bedi and his team for taking care of all the tech arrangements as well as for organizing this. Thank you, Dr. Sucheta. Thank you all the faculty, and a very warm thanks to Group 6 members as well as all the attendees. Good night and thank you.
Thank you for this nice presentation.
Thank you, ma'am.